I call it the trusted advisor. It's somebody that's outside of you that you would trust their opinion. They're not going to try to be nice to you, and somebody that you feel safe with. And then you can just ask them about these things that are related to burnout, and like, have you noticed that I've been more irritable lately? Have I been complaining a lot more about the job? Do you feel like I still have my purpose? Like, somebody that you really trust that you can ask about these things.
Welcome to the Licensed to Live show, where professionals, doctors, champions, VIPs, attorneys, and those in public office discover strategies that help you restart and gain what is lost when you find yourself accused. If another has doubted your integrity, questioned your credentials, or caused your actions to come under scrutiny, you are in the right place. On the other hand, if you have never felt the knot in the pit of your stomach when legal papers are served, the heartbreak of disappointing your family when the lock clicks shut on handcuffs, or had to appear before a board of review, then be aware, the longer you serve, the more likely you are to find yourself under the microscope of those who judge. Prepare yourself for this uncomfortable possibility. Now, here's your host, Dr. Jarret Patton.
Welcome to this episode of Licensed to Live. My name is Dr. Jarret, and I'm your host for our journey together today and every day you choose to listen to this show. If you or anyone you know has been dissed by the healthcare system, please invite them to join us along this journey. Just go to Apple Podcasts, Google Play Podcasts, Stitcher, or anywhere you get podcasts and subscribe to the Licensed to Live show. When you are there, please rate this episode and give me honest feedback so I make sure I provide you with the most up-to-date information about career and life changes. When I say dissed, I mean disengaged, like, this medicine thing is not what it's cracked up to be. Too much paperwork, too many administrators telling me what to do, or I don't have enough time with my patients. Dissatisfied, like, I just don't feel like I'm living up to my full potential. This career simply isn't fulfilling. Disgruntled, like, being a doctor has taken too much of my life away. I am in debt up to my eyeballs, and I am upset because my work life is too full and my real life is left barren. Or disenfranchised, like I was when I had my medical license temporarily suspended. This show is not for those physicians and professionals who are happy and fulfilled in their career, or those who have never had a setback in life. If you are in this category, you should make sure you tell a friend to listen to this podcast. Today we'll be talking with Dr. Dianne Ansari-Winn, an anesthesiologist, an author, and an executive coach for physicians. We will discuss her exit from clinical medicine as it relates to physician burnout. Before we get started, I would like to let you know about a special opportunity coming up. I've gotten so much feedback on the podcast that I am offering a webinar coming very soon. So many people feel trapped in their current careers and are afraid to break out and live to their true destiny. This live webinar will give you 5 strategies to get your career refreshed and restarted despite your limitations, past failures, and unforeseen circumstances. Take your life back and register for this masterclass now at restartwebinar.com. That's restartwebinar.com. Hey, fire starters. I have a special guest for you today. I have Dr. Dianne. Dr. Dianne is an anesthesiologist. She's a coach. She's an author. She's also a fellow podcaster of The Doctor's Life. I am so excited to have her here today with you guys. We're going to be talking physician burnout. We're going to be talking a whole bunch of things. I've been working with Dr. Dianne for quite some time now, and I tell you what, our conversations just get long-winded, so you guys will just get lots of information out of this podcast today. So Dr. Dianne, thank you so much for coming on the show today.
Dr. Jarret, it is my absolute pleasure. And I love that we're continuing the tradition of podcasting. As your audience may or may not know, as you mentioned, I do a podcast called the Doctor's Life podcast. And you have been a guest on the Doctor's Life, not once, but twice. And so that actually puts you in, so far, I don't think I've done 2 podcasts with one doc. So you are in a unique club.
Yes.
It's great to be back with you.
Absolutely. I feel so great. I know you have so many great things to share with the audience today. So I'm just going to get right into it today. And the first thing I want to know from you is, which was more difficult, your entrance into medicine or your exit out of clinical medicine?
Yeah, I love this question. So just as for a little context, you know me real well, Dr. Jarret, but for the audience there, I'm an anesthesiologist by training, and I did leave clinical medicine 6 years ago, and now I pursue, happily, I must add, a non-clinical career, including coaching and doing the Doctor's Life podcast, as we mentioned. Interestingly, I've actually just launched a coach training school for physicians so they can be like me and do peer coaching. So I'm super excited about that. So with all that excitement, it might have sounded like maybe exiting clinical medicine was the easier part, but I think in a way entering medicine was the easier road, in the sense that, I had wanted to become a physician since I was 13 years old. And my cousin, who's 10, 11 years older than me, he is the only other doctor in our family. And so he really encouraged me by example to go into medicine. So I wanted to be a doctor since I was 13 years old. Yet in order to go into medicine, you need to be pretty smart. So I was super smart. I got all A's and, went from high school directly into college at 16, actually. I turned 17 the fall of my freshman year. And then I went straight through undergraduate into medical school, and then, residency and everything. I think in some ways it was easier to go into medicine because even though it's hard and there's a lot of studying to do, and there can be times where you feel like you're maybe not going to make it or you're not going to get accepted into med school, or even while you're in med school, there's a lot of studying to do, a lot of work to be done. You're still with around people that support you. And you probably experienced this too yourself, Dr. Jarret, where, when you tell people, even when you're a teenager, that you want to be a doctor, people are like, oh yeah, that's awesome. Like, that's great. Go for your dreams, And then when you're in in undergraduate and stuff, it's competitive, but you're in this cohort of people who want to get into med school. So you're supported. And even like people who drop out and they might hate you a little bit later because you got in, like they sort of begrudgingly hate you because they know that it's like a good thing. To be a doctor is undoubtedly a good thing, I think. So, right? So,
you're right.
You get supported like the whole way through. And even like in med school, we had your fellow students support you. And even though you stumble sometimes and you may or may not, you get pimped dry and you stay up late at night and all that stuff, like your life becomes medicine, and you get so much satisfaction out of studying medicine and practicing and learning medicine. Like we used to be excited about like starting IVs. Do you remember that, Dr. Jarret?
Oh, yes. In fact, I used to get nervous over starting IVs. It used to be one of those things where I said, oh, this is great. I can do a procedure. But then for me in pediatrics, you start messing around with these small veins. And I said, oh, man, let somebody in here who knows how to do this.
Right. But like, yeah, exactly. When you first start, it's just the opportunity to be able to do it is, I remember like when I was a third year med student, the nurses would come and find us, and, come to find out later, of course, they were probably just wanting to pawn off some of that work to us. But, at the time, they're like, go find the med student because they will love to draw that blood and they will love to do that. So it's just great learning things. So getting into medicine, it's a challenge, but you feel supported the whole way.
Credentials verified.
And in contrast, I would love to hear your thoughts on this too, Dr. Jarret, is that when you leave clinical medicine, it is not the same. I mean, I won't go into a lot of detail about my personal story, but the highlights are that after 15 years of successfully practicing anesthesia in private practice, doing all of my own cases, working those nights and those weekends and, giving everything to it, I left clinical medicine because of burnout. I honestly thought that in some ways,
oh no, not another test.
It felt like the end of my life as I knew it, literally because of changing careers, but also internally, figuratively. All of my friends were doctors. My husband at the time, he's a doctor. Like I said, I wanted to go into medicine since I was 13. So I felt like medicine literally was in my bones, literally. Like I couldn't do anything else. I couldn't be anything else besides an anesthesiologist. When it was suggested to me that I take a break because of the toll it was taking, I was like, who in the heck am I going to be? If I'm not a doctor, who am I? That was huge. So I would say that actually leaving clinical medicine was one of the hardest things that I've ever done in my life. Now, 6 years later, I feel great. I've worked with coaches. I've trained as a coach and I work with doctors. And so I know that it's important to be able to have these choices and not feel like a lot of shame and guilt and angst about it. And if you have, if it's due to burnout or if it's due to some other circumstance, it kind of feels like out of your control or like it wasn't completely a choice, that having self-care, taking care of yourself, doing the things that you need to do so that you can move forward confidently is really the key. And so, long story short, 6 years later, I feel awesome. But I didn't feel so good 6 years ago.
Oh no, judgment.
And I wasn't like, leaving medicine like I did. I still remember the day I walked across the stage, medical school, University of Michigan Medical School, and they put that diploma in my hand. One of the proudest days of my life. So, yeah,
it definitely is something to be proud of because it is a great accomplishment. A lot of times, especially with the some of my coaching clients as well, and myself included, you get to a point in your life where you get stuck. You think to yourself that, hey, I'm a doctor. That's all I know how to be. I've spent all this time in this competitive process that you are trying to trickle up a hierarchy of different levels from student to advanced student to junior faculty to full-blown faculty. And then the list goes on and on and on as you're trying to climb these ranks. And between the weeding out process and the competition that's out there, it really can wear a lot of people down. But at the same time, I think that it does a good job of brainwashing you, and in your mind and in yourself, you say to yourself, I am a doctor and that's who I am. That's what I am. And that's all I know how to be. And so trying to get people to see beyond that, like you have 6 years later, things are great, but it's a very difficult step. And sometimes it's a hard sell to people in the beginning. So I definitely go with that. And I wanted to touch on one other thing that you mentioned is that confidence. Your confidence as you're coming through the system gets greater and greater and greater from the time you start that first IV to the time you've done your 50th IV to the time you've done your 800th IV. That confidence builds, and each procedure, each time you see a patient, each time that you go forward, you have a great confidence because you know you are skilled in what you do. At the end of the day, when you are no longer doing those things that you have built up such a long pedigree of skill, it becomes very difficult because a part of you loses some confidence.
Not only is confidence recovery a major topic in the License to Live book, it is also a topic in the Career Restart webinar. In this upcoming webinar, we discuss ways in which you can regain the confidence that you once had. Plus, you will learn 5 strategies to restart your career. Be sure to register now at restartwebinar.com. That's restartwebinar.com.
Yeah, that's it. That's a really interesting point. I know that you work with your clients around that, losing that confidence. And I think you're right. When you said brainwashed, I kind of went, yeah, that's an interesting point because, you are immersed in medicine and like what I was saying before, everything around you is supporting you, Dr. So-and-so. So they support me as Dr. Dianne, support you as Dr. Jarret. But, somewhere in there is still, plain old Dianne, and not plain old Dianne, but you know what I'm saying? Dianne, the human being, the Dianne, the mother, the healer, the one who cares for others, the compassionate one, the one who likes to have fun, the one who likes to work hard and do puzzles and to have those life experiences that any person wants to have, doctor or not a doctor. I think that's kind of where the brainwashing comes in, because once you put like that layer of doctor on top, somehow we can be convinced or forget that we're still mere mortals too, and that we have the same wants, needs, desires that any other human being has.
And I agree with you completely there, because often when I'm speaking in front of medical audiences, I'll talk about how often as physicians we identify as the identity of a physician first. Mm-hmm. And many times in life that trumps everything. It trumps all those other pieces of you, the parent, the friend, the person that likes to have fun. And you end up having that human quality second. And that gets people into trouble and leads to blocks in confidence when it's time to move on or think about doing something different. As I think about your podcast, the Doctor's Life podcast, and you set it up so that it's like we're having a conversation in the doctor's lounge. Yeah. And I love that, because as a pediatrician, I didn't spend a whole lot of time in the doctor's lounge. And a lot of times people didn't know who I was or even, spent too much time trying to talk to me. However, once I was the president of the medical staff, I made a deep intent to get into that lounge and speak with other doctors. And then all of a sudden people were seeking me out and finding me and spreading things, because you understand from the administrative process things that are going on. But then there's a whole lot of things you don't know that are going on the front lines that makes it very, very difficult for people to express those things. And sometimes it can be frustration. Sometimes it's even identity things, or it could be even patient safety things. But when people identify with others, they can kind of come forward with a different understanding of a reality, and to get people to see beyond just that identity of a physician is incredibly important. And I love what you stated there.
No, thank you. Well, it's, having you hang out in the doctor's lounge, not once, but twice, has been a great honor. And I'm glad that you get that feeling, because that's, as an anesthesiologist, There were times where I spent more time in the doctor's lounge. Sometimes, a lot of days, it was just to quick go grab whatever I could grab, turn around, and eat it on the way back to the OR. I got very good at like eating and walking.
Let's put it out there, Dr. Dianne. How might a person know if they are suffering from burnout?
Can be kind of an insidious thing. The Maslow's has a triad of burnout where you sense the depersonalization, where like you start to view people as objects, and then there's also a profound fatigue, emotional exhaustion, and then the third part is where you're not feeling like you're very efficacious, like you feel not very good at your job. So that's technically how it shows up. Looking at it more like from the question of like, if someone asked me, how would I know if I'm burned out? I would tell them, one, it's on a continuum. So there's one thing like I'm sort of tired of my job. And then there's like another piece where you're completely burned out. So I think the way that it tends to show up is, again, like that intense fatigue, the feeling that you're not good at your job, even though like there's really no evidence to the contrary that you're still really good at your job. When you start seeing others as like, people start to get irritated with the patients, like the patients are the problem. When, if you remember, like when you first started med school, the patients were great and everything else might have been problematic. And if you're looking at it from does a colleague have burnout? Are they taking more sick days than they used to? And on that note, are you noticing that your health is suffering? Is your sleep suffering? Are you starting to drink more if you're a drinker? Are you starting to dabble into drug use? Dangerous behaviors, those can all show up as burnout. What are your relationships looking like? Are they starting to suffer? That irritation isn't necessarily just with patients. It can go to staff, colleagues. And then I think the most harmful part is when it starts to spill over into our friends and family, the people that we love. Do we feel disheartened? Do we feel like we've lost our purpose? Have we lost our sense of self, our identity? It's not the same as depression, but it can be similar in the sense that sometimes the depression can show up as anxiety, or it can show up as anger or fear. So like having a lot of these intense emotions can be signs and symptoms of burnout as well. But it can show up in a lot of ways for sure.
Very interesting, Dr. Dianne. I think with all of our various sides to our professional lives, burnout can manifest in a lot of different directions in a lot of different ways.
Yeah.
And it ends up, from summing up what you're saying to us, is that it can really just creep up on you and you may not even know that it's there.
Yeah, I think a lot of docs are in denial, of course, because we view ourselves as being superhuman and we're propped up to be superhuman. So, I know for myself, I probably felt like I was suspicious that I was feeling burned out probably about 2 or 3 years out from actually having someone from outside of me just call it. So, I just chalked it up to like, I was feeling tired. I was not liking my job. I just was chalking it up as being like a temporary situation. Maybe I just needed more sleep. Maybe I needed to eat better. Like, we're doctors, so we're always trying to figure stuff out for ourselves.
Heal thyself, doctor. Heal thyself.
Treat ourselves. Sometimes our initial diagnosis is off, What I recommend to docs is that they actually find somebody that they trust. I call it the trusted advisor. it's somebody that's outside of you that you would trust their opinion. They're not going to try to be nice to you, and somebody that you feel safe with. And then you can just ask them about these things that are related to burnout, and like, have you noticed that I've been more irritable lately? Have I been complaining a lot more about the job? Do you feel like I still have my purpose? Like, somebody that you really trust that you can ask about these things and see what they say. You might be surprised where, people start confirming, you're not the same as you used to be when you started 5 years ago, or, and it's something to look at. Another thing though, and I just want to add in, is that since some of these symptoms, like this, especially the somatic symptoms, the sleeplessness, or maybe the tendency to not take care of ourselves or feel more tired and that kind of thing, I just want to make sure that another important thing, speaking of not diagnosing yourself, doctors, is to go see a doctor.
Yes.
Make sure that you don't have a medical condition. This hypothyroidism can show up, or diabetes, depression, as I mentioned, anxiety disorders. So these can all show up, and it's good to have someone that's outside of you to help you with these things. And you certainly don't want to be just chalking up a treatable medical condition to burnout.
Wow. Fire starters. You just got some jewels in this podcast. Dr. Dianne says that there are a couple of recommendations. Number one, get a trusted advisor to help you try to sort this out in your own head, maybe give you some more objective evidence. And two, see a doctor. A lot of times we're afraid to see a doctor because, well, what do doctors do? They find stuff, but it's for our own benefit. Yes, we've got to get that done, and we've got to get beyond that. And I know that there are a lot of times that people fear the medical boards if they are labeled with a certain diagnosis, or maybe they'll go get counseling and they'll drive in a car 2 hours away and use a fake name just so nobody knows who they are. But times are beginning to change, and this is not the world that we're living in now. It is far better for you to go get some help than to try to help yourself with other substances or other things, or seeing your job performance slide as a result. So absolutely great advice, Dr. Dianne. Thank you so much for that.
Anytime.
So
I love to talk about this. It's just like, why does she love to talk about burnout? Because I believe in doctors, and I believe that, and when we're healthier, we're better, not only for ourselves, but for our families, our community, for our world. That's why I like to talk about it. I like to help docs with this. I'm teaching now docs how to be peer coaches so they can help other doctors. I just really believe that this is the movement that I was called to help lead, so that we can improve our profession, help each other, raise each other up, and heal the world. Doctors are just so important. Some docs do take their own lives. It may or may not be attributed to burnout, but certainly it's been associated with it, not correlated or caused, but it does come up. Even not as serious necessarily as suicide, but if a doc leaves a profession that they didn't want to leave because of burnout, and there's a way that we could have prevented that, then that's all the more benefit.
The Comeback.
On the flip side, though, Dr. Jarret and I are living great lives outside of clinical medicine.
That's right. You have a choice.
There are choices.
Absolutely. And whatever may make you and take you into that leap of trying something different, if it is too much or if it isn't, just have the confidence in yourself. You've gone through a long road as it is. Make sure that you're not going to have a problem doing other things.
Right.
Whether it's in medicine, it's completely out of medicine. I've worked with pharmacists that have become real estate moguls. I've seen, doctors that are DJs.
I mean, I've seen so many different things that have happened with people that they are, they thought that they were being led by being a physician and that was their only identity. But when they can uncover that thing that's underneath that physician identity, that true self, people can go a very long way. So thank you, Dr. Dianne, for being a part of the show today. Where can people find you on social media?
Well, they can find me pretty much everywhere on social media these days. I have a Facebook Live show, Instagram, Twitter, and LinkedIn. And you can find me on all of those platforms at the @ Dr. Dianne, MD. You can also find my website. That's www.drdianne.com. That's www.drdianne.com. And you can also listen to the Doctor's Life podcast through that website, www.drdianne.com. On that website, too, if we've been talking about burnout, so I do have a quiz there called the Physician Vitality Assessment. So I invite you all to go to the website, take the assessment so you can see whether or not you're at risk for burnout.
Thank you so much for that. Go to Dr. Dianne's website and take the Physician Vitality Assessment. That's one step. And I'm always talking about taking action. You can take action right now by going to do that. That's one step that may save you a whole lot of headache and trauma on the long term. Thank you again, Dr. Dianne, for being on the show. Is there anything else you'd like to tell our audience today?
Licensed to live.
I just want to underline that we all have choices in life and that our circumstances do not define us. They actually refine us. They make us better. So whatever you're going through, just know that it's part of the process of living. There is a way through. Get the support and the help that you need so that you can make strong decisions and live an amazing life. If you're listening to this podcast, I know that it's not only possible, but that it's going to be easy to do once you decide to do it. So I wish everybody the very, very best in health and happiness.
Thank you so much for that last piece because it is so important. Fire starters, take care of yourself and know that these moments, although they are defining in your life, they don't have to define you, and you can move on and you can do other things. Dr. Dianne, thanks for being on the show today. And make sure you go take the Physician Vitality Assessment on drdianne.com.
Thanks again, Dr. Jarret. Always a pleasure. It's great to have a kindred spirit and a fellow fire starter in my world.
Yes. Thank you, Dr. Dianne. Absolutely. Absolutely.
Remember, fire starters, if you or anyone you know has been disengaged, dissatisfied, disgruntled, or disenfranchised with healthcare, please invite them to join us along this journey. Simply go to your favorite podcast distributor and subscribe to the License to Live show. And while you are there, please rate this episode and give me honest feedback so I can make sure I provide you with the most up-to-date information about career challenges and life changes. And don't forget to sign up for the free live Career Restart webinar at restartwebinar.com. See you next time.
No matter how disheartening the moment of accusation sounds, how deep the pain of immobilization stabs, or how bleak your future looks, no one can take away your license to live. Keep Dr. Jarret's expertise handy and unlock your future. Go to Apple Podcasts, Google Podcasts, or another podcast player and subscribe right now to Licensed to Live. See you next time.